Hi, I'm Dr. Thangudu. I'm a physician who focuses on diabetes, thyroid, and other hormonal and metabolic diseases. Thanks so much for being here, and please don't forget to like, share, and subscribe to help me get the message out on evidence-based endocrinology. We live in a world where there is so much confusion about hormones, and I'm here to clear it up based on my expertise and the evidence that we have. Today, we are going to talk about cortisol. More specifically, we're going to talk about the circadian pattern of cortisol secretion. So cortisol is the stress hormone that we talk about the most. It is secreted by your adrenal glands, which sit above your kidneys, and it is secreted in a circadian pattern. So it peaks in the morning and then throughout the day flattens out to its lowest levels overnight when you're sleeping. This is because cortisol is a hormone that wakes you up. So it increases your blood pressure, it increases your blood sugar in the morning and perks you up. And then during the day, we don't want high cortisol levels because it will wake us up and we want to be sleeping. So cortisol follows a circadian pattern of secretion. This is important to know because the reference ranges for cortisol in labs are for that morning testosterone level, the peak. So if we are trying to determine if a patient has low cortisol and we check in the afternoon, well, it's always going to be low, and that's normal. So if you are having a random cortisol checked, you should have it done in the morning. However, a random cortisol check is not enough to make a diagnosis. For low cortisol, you need to have something done called an ACTH stimulation test. That is a special test where they check baseline labs and then inject you with something called concentropin, which is a synthetic version of a brain hormone called ACTH. ACTH stimulates the adrenals to produce cortisol. After they give you this injection, they check your cortisol about 30 and 60 minutes later to see how your adrenals respond. So if you've ever been diagnosed with low cortisol or issues with cortisol and you haven't had an ACTH stim test, then we haven't made a definitive evidence-based diagnosis. There are several tests available online that you can have done at home, salivary tests that are done in some clinics for cortisol deficiency. These are not evidence-based. So we really need to make sure that we make a solid diagnosis before putting patients on medications for low cortisol. And the reason for this is because if you don't have an appropriate diagnosis and you start taking medications that have cortisol in them, your body will stop making cortisol because it's getting it for free somewhere else, right? Or maybe not for free, maybe that supplement is really expensive, but the body says, hey, I'm getting it from somewhere else, I don't need to make my cortisol anymore. So if you were to have been put on inappropriate supplements or medications for low cortisol that wasn't diagnosed correctly, you could have something called iatrogenic adrenal insufficiency. That means your body has been getting an outside source of cortisol, so it has stopped making it. And this can become life-threatening. So if you have been diagnosed with adrenal problems or low cortisol and are on supplements or medications, make sure that your diagnosis was made appropriately. If you feel like it wasn't, don't be afraid to get a second opinion from a specialist. I hope this was helpful. I'm here for you and to help educate about endocrinology topics that can be very murky from Dr. Google. Please don't forget to subscribe, share, and like. Thanks so much for being here and see you next time.